Don't be confused. I've had a lot of people reaching out to me letting me know, hey Steve, the Biden administration, they extended the COVID public health emergency, which means an additional 90 days of an extension to provide more stimulus funding for low-income individuals, overruling the Medicaid requirements, providing SNAP emergency allotments, the pandemic EBT benefits. They're going to go on for another 3 months. Well, you guys, I want to make sure that you know the truth and see the latest updates. Now, it is true that they did extend it out an additional 90 days, but in regards to the USDA Food and Nutritional Services announcement to change benefits, no, these are not changing. They are staying in place. All of the benefits that we have heard are going to be coming to an end February of 2023. They are still set to come to an end. Now, many states, they distribute their benefits a month later. So please prepare. I want to make sure my entire viewing community knows the truth. There's no confusion. They're not getting extended. Prepare for these to come to an end. Now, I'm going to be giving you all the details, and to prove it to you, to make sure that there's no confusion, I'm going to be putting this on the screen, reading right from it, and I'll also link it in the description so you can see it for yourself, because I want to make sure that everybody here on my channel has the latest up-to-date information and they know what's going on. Now, if any of this changes, know that I will be the first happily to hop on here and let you know that Congress changed their mind yet again. But I want to make sure that at this time, people are making preparations for this to stop, because it has not been reinstated. And I'm going to be covering all the details for you in this video. And for more clarification on those $1,232 payments going out from the IRS that was announced just a little while ago, stick around to the end. I'm going to get you some more information on that as well. And yes, that information is true. So let's go ahead and dive right in, get you caught up on the latest. Now, also, if you want to know about stimulus provisions for states, cities, and counties, check out my website, www.reliefroadmap.com. A comprehensive list of literally over 100 different stimulus check provisions available to different eligible groups. Also, if you want to stay up to date, it's totally free. Why not hit the subscribe button, turn on the notification bell. I'll let you know what's happening with legislation, Congress, our economy, what's available to help out you and your family. And if you appreciate that, smash the like button for me. But with that being said, let's go ahead and get you caught up on the latest. Let's go ahead and dive right in. All right, so link in the description below to this article came out last week when the Biden administration announced that they were going to be extending out the state of emergency for an additional 90 days. But it's also going to be covering for us the details of what is getting extended and what is not going to be extended. So it says Biden administration renews COVID-19 public health emergency. And it says the Biden administration on Wednesday, this was last week, again renewed the COVID-19 public health emergency, a provision that gives the administration authorities to respond to the pandemic as cases are again on the rise. U.S. Health and Human Services Secretary Xavier Becerra renewed the declaration on its expiration date, so they waited till the very last day, an expected step because officials have said that they will provide a 60-day notice if they do not plan to renew the emergency and had not done so. So we anticipated that it would be getting extended out because there was not that 60-day notice. Becerra renewed the COVID-19 public health emergency because there's still a lot of COVID out there. And the public health emergency and his determination gives us tools to fight this. White House COVID-19 response coordinator Dr. Ashish Jha told CNN. Now, Jha stressed that the highly contagious XBB.1.5 variant was just one of the variants that prompted the decision, but it wasn't the only reason. The secretary made a decision that the tools of the public health emergency are still necessary to continue to fight the virus. So they're saying this is still going on. We still need additional assistance. The public health emergency gives the federal government wide-ranging authorities over a number of COVID-19 related areas, including data tracking and allowing pharmacists, rather than physicians, to administer the COVID-19 vaccine, among other provisions. Now, here it is. However, the federal government spending law enacted last month, and that was that $1.7 trillion budget spending bill, it decoupled several major relief measures from the public health emergency. So typically, when he has this public health emergency extension, it also extends the spending and the funding that can go out for the state of emergency, but they're saying that was broken with that spending package of $1.7 trillion that just passed. Now, the package is phasing out the requirements that prevent states from disenrolling Medicaid recipients as long as the public health emergency is in effect in exchange for an enhanced federal match. This continuous coverage measure was enacted as a part of the COVID-19 relief package passed in March of 2020 and has led to a record 90 million enrollees in Medicaid, many of whom may no longer meet the income requirements to qualify. So if that is you, one of the people collecting Medicaid due to the pandemic right now, they're going to be able to disenroll you in this, and you need to be prepared in the coming months. Now, states can begin processing Medicaid redetermination as of April 1st. So that is how long you have, regardless of when the public health emergency ends. Estimates vary on how many people would lose their Medicaid benefits, though they range as high as 19 million. Many folks, however, could qualify for the coverage. Also, the federal government has been providing enhanced food stamp benefits, or those SNAP emergency allotments, to millions of Americans during the public health emergency. Those beefed up monthly payments, they will end after February. So there you can see it for yourself. And again, I'll link it in the description below. Just want to make sure you guys are aware and can prepare for these to come to an end as it currently stands. And as a part of the spending package, Congress extended the 2 years of telehealth flexibilities that allowed more Medicare enrollees to access virtual care. Now, the reason for the emergency declaration extension of an additional 90 days is because COVID-19 cases are on the rise again. The sickness is going around with that new variant. And it says Wednesday's renewal comes amid the emergency of the Omicron XBB 1.5 subvariant. The latest data from the U.S. Center Disease and Control Prevention shows that the 7-day average of weekly new COVID cases is up 16.2% compared to the previous week. So we are starting to see a new wave ramp up. Now, the Centers for Medicaid and Medicare Services is in close contact with states and other key stakeholders about how to protect Medicare and Medicaid beneficiaries once the decision is made. The COVID-19 public health emergency remains in effect, and as HHS committed to earlier, we will provide a 60-day notice to states before any possible termination or expiration. Additional information about public health emergency declarations, including frequently asked questions, can be found on our website, HHS spokesperson told CNN. And reports of a set April end date are untrue, according to an administration official, as decision-making continues at HHS. So there's a rumor going around that we're officially going to come to an end of the state of emergency for the pandemic in April. They're saying that is not true. They're willing to keep going with this as long as they need to. Now, the decision to terminate the COVID public health emergency will be made by the HHS secretary based on the best available data and science. Any suggestion that a specific end date has been established is untrue, they've said. So I know that's probably not what people want to hear. They wanted to hear that this was going to get extended again, but I want to make sure you get the accurate information, and I hope that clears up everything for everybody out there and you can know what's going on. I'll make sure to report to you whatever unfolds on this. Now, also, in addition to that, I've also provided some clarification on the announcement that came out from the IRS of $12,032 checks going out to somewhere between 12 million and 14 million people around the United States. They announced this just a couple weeks ago to kick off the new year. If you want more information on that, who's going to be eligible receiving it, there's 4 different groups I cover in detail for you so you can know, and I cite all the sources in this video right here. So if you missed that one, check it out next, and I'll be sure to keep you guys up to date. With that being said, thank you for joining me. Smash the like button, subscribe to see more, and I'll catch you in the next one. Take care. God bless. This is Steve.